Hi, welcome. I'm Stuart Post. I am the IMDM for healthcare in the South Central. With me today is Skip Rodenbush. He is the CMO for Astound Technologies. And Skip, we appreciate you coming out today.
Well, thank you.
Tell me a little bit about your background.
I've got a lifetime in developing applications that streamline communication between people. I did some work in the early 90s developing virtual business terminals for banks and virtual concierges for hotels. Always been at the forefront of video conferencing and webcasting technologies.
So what I think everybody wants to hear, we like to work with partners within healthcare. We like to bring the partners in. So tell us a little bit about Astound Technology, because it's not a household name. A lot of people don't know who you are, so kind of give everybody an idea of what the company's doing.
Okay, Astound is a Microsoft business partner, and we're based in Walnut Creek, California. And our background is in the call center, developing interactive solutions that tie together automatic call distributors, are called ACDs, interactive voice response, voicemail, and the databases, so that when a call is answered, the information that was gathered is sent to the agent. And then again, when you get transferred, that same information is sent, and you don't have to repeat your name and your account information over and over again. So about 5 years ago, we started focusing in on developing a video software ACD that was switch and route video so that people could be virtual, or specialists particularly, where they're needed. Right.
So tell us a little bit more about the product, the virtual specialist.
Well, the virtual specialist is a method whereby a specialist can be to the point of care electronically. Remember in the State of the Union, Obama said in 5 years it would be possible to have a video chat with your doctor.
Right.
Well, we not only provide the ability to have a video chat with your doctor, but we enable you to have video communication and collaboration between primary care physicians, a health team, a specialist, and the administration of a hospital. And we can do that with Lync and PCs today. Not 5 years, but now.
Okay. So tell me, why'd you decide to build this on initially the OCS? I know that you're going to be migrating over to Lync. So why'd you pick that Microsoft solution?
Well, the big stumbling block, as we have seen it through the time that we've been working on developing this, has always been switching and routing a call, just like you would switch a voice call. When you call in on a telephone, your call is answered by a switchboard operator, and they transfer the call to who you want to talk to. In healthcare, video comes in on a point-to-point basis. If you're not there to answer the call, it doesn't get answered. So what we wanted to do, and the OCS and the Lyncs now are offering us a perfect platform to be able to switch and route IP video throughout an enterprise. So it came along at exactly the right time for us. We've been, like I said, a solutions partner for quite a while in the call center space. So we took that knowledge of how calls move around and applied it to video. So now we can queue, switch, route, and put calls on hold, just as you would a voice call.
Okay. I think probably most people understand telemedicine, and they understand how the video and the conferencing ability with telemedicine, how hospitals are starting to move to telemedicine. We're starting to actually reimburse physicians for consults via telemedicine. But who else in the hospital might be of interest up to this solution?
Ever since Bell invented the phone, people have wanted to see who they're talking to.
Right.
Adding visual communication in a healthcare setting has got unlimited applications. From the pure clinical of having a doctor appear at the point of need to the non-clinical, which could be everything from a bedside visit by friends and family, patient education, employee education, training, help desk support, even have the ability to pop up on a kiosk for giving information out when somebody comes to a hospital. There are applications galore, and what we believe is that once the management of healthcare operations see what can be delivered through collaborative communication, visual communication, the applications will come from everywhere.
Okay. All right. So how does this product and this solution help position hospitals for the future of healthcare as we start to do the continuum of care, bringing not the patients in, bringing in the nursing home, bringing in rehab? How does this help? And how is it, if you can tell us, because I think some people still might be not quite sure, how is it different than just your typical telemedicine point to point?
Well, in healthcare, there's a big gap between supply and demand. There's a shortage of expertise up and down the system. And this demand from urban to rural, we like to say from daycare to elder care and everywhere in between, we want to be able to deliver telemedicine.
Right.
And the legacy systems, the traditional approach, has been based on hardware solutions that are very expensive and will never be ubiquitous, do not integrate with IT.
Like Tamwork.
So it's very key. So what I see happening is that we are able to improve the quality of care dramatically through the visual contact with the patient and the referring physician in a continuum of care situation. We can take a lot of the travel back and forth to the doctor's office out of the equation.
Right.
We can save, I was reading on the plane today, they're talking about gas being $5 a gallon pretty soon. There's all kinds of incentives out there to do telemedicine because of just the frustration that we all go through when we have to make an appointment to go see a doctor, sit in a waiting room. If you could just have a virtual visit from your home, many times that's all it would take to renew a prescription or to maybe check your blood sugar and have a little conversation. Lots of healthcare applications, and telemedicine, as you mentioned, has been out for a long, long time. But the big problem has been it is forcing physicians to have to work around the way the telemedicine hardware works. And we take a different approach. We're able to customize interfaces so that they really complement the way caregivers work. And the big thing is we're about 10% of the cost. So what we're envisioning is a healthy lifestyle type of an application that can be on everybody's computer.
Okay. I know there's a use case. I think the University of Illinois Chicago. How are they planning on using it? Because I think the key to the reason they wanted the virtual specialist was the whole idea behind it that it's not point to point, that it allows it to route to whoever might be available, and the person who's initiating the call doesn't have to care, and it just basically can do the transfer.
Exactly. They're using an application that we developed around the OCS R2. We'll be migrating. But it basically is a single icon that will connect a student to the student center, student health center. They have about 10,000 students that are in a campus insurance program. So the ROI is to make their physicians more fluid and be able to link up virtually and take care of students instead of having to bring them into the clinic for everything that they need. And from that, UIC is working as an adjunct of the state of Illinois, and there are great ramifications for extending this throughout the state into rural hospitals for critical accessing specialists, et cetera.
Okay, all right. And I know that everybody there wants me to ask this question because this is very important to the account executives. What all is the technology that's necessary? I mean, obviously we know it's OCS, but how is this going to help our account executives? I mean, is it going to pull through Windows 7? Is it going to pull through SQL Server?
Well,
tell us about that.
I'll tell you what we work on right now. We work on OCS R2 links. We're developing that right now.
Okay.
We use SQL Server 08. We use IIS and Ajax tools. We use Windows in 7 and Vista and XP. We are developing applications for even the Windows Phone.
Great. That's
So
important.
we feel like we're an application that can bring together a lot of disparate parts of a healthcare institution and enable them to all collaborate from the desktop. If I were working in a large account, I would be talking about how this eliminates a lot of necessary logistics. For instance, in language interpreting services, for instance, finding an interpreter to get to the bedside
Right.
at a major institution is very, very difficult. With this, they can be there at the touch of a finger.
Okay. Final question, because I know you have to go. If somebody's walking in, they want to talk about the virtual specialist too, who's the number one person they should approach with this solution in the hospital?
I think it's the Chief Medical Information Officer,
Okay.
the CMIO.
Well, good. Enjoy the
Listen,
show. Thanks
Thank you
so
very much.
Appreciate your
I
time.
appreciate you having us in, and on behalf of Astound Technologies and Dr. Valdez, I'd like to thank you for this opportunity.
All right, great. Thank you.